the majority of our patients, I think we researched the numbers in almost like 79% of our patients are over 80. So they're going to need a wheelchair or a hospital bed, or they're going to need something, and they're having to be discharged home without those hospital beds or without those wheelchairs. And then we're in a scramble to try and find them. Like the low beds, I know that they come from a company, like this is Denton, and we searched and searched, and we finally found a company that did the competitive bidding in Garland, and that's about 27 or 28 miles east of here. So when I finally got them to agree to bring a low bed for a patient who had came out of hospital with a hip fracture and who'd fallen twice on a regular bed in the assisted living, they ran all the numbers, which took several days. Nobody would answer. I'd have to leave a message. They would call. I would be out with a patient. I mean, it was like a 7 to 10 day ordeal. And then finally, when they did agree to, they ran the numbers. Her Medicare numbers were good, but they'd only deliver it out to this area on Tuesdays. So here we are, looking at 2 weeks after this lady's been discharged from the hospital in need of a low bed, who fell and broke her hip off a bed, and has fallen off her regular bed twice. So we're learning to improvise the best that we can, but it's not in the best interest of the patient or safe, or keeping the patient safe. It's keeping the patient safer. Mm-hmm. We had someone who was sent home to an assisted living from out of town. There was her caregiver died unexpectedly, so her family lives here, so they brought her up here to put her in an assisted living. And she needed a wheelchair, and all the facility had was just a transport wheelchair because she couldn't walk, and she needed a low bed for frequent falls. I mean, we couldn't, it took us over 2 weeks to get that for her. She had like 3 falls in that 2 weeks. Now, thank goodness none were serious. They were just skin tears to the arm, but they could have been very serious. We had someone discharged from the hospital with a wound vac, who had fallen, had a hip fracture, and had a surgical replacement of that hip that had got infected and dehisced. So she was stuck laying on her back. She really couldn't lay on her side because that was where the wound was. And we had put her on the other side, but she developed decubitus on that. So there was only her back or her side we could place her on. The hospital, when she was discharged, they ordered an air mattress and a hospital bed because she was falling out of the bed. We tried for 3 weeks. The decubitus on her coccyx, on her both buttocks, and on her hip got worse. We put catheter in to keep her as dry as possible. We could not get a hospital bed with side rails, so we had chairs pushed up to keep her from falling out of the bed. And the family gave up. We just finally gave up and purchased that equipment because the decubituses were fixing to get to a point where she would probably had to go in and have medical intervention for them if we wouldn't have. So competitive bidding has been a nightmare for especially the rural areas or a smaller suburban area out of a large town, because the small DME companies that we counted on, that we had a relationship with, who would come forward and say, we'll get that out there for you this afternoon, even if we have to stay late, that's gone. We don't have that relationship. We have one company that serves the whole Dallas Metroplex area, and there really is not, I mean, I'm sure they're doing the best they can, but every time I call, it's still staffed with one person, even though I'm sure their business has gone up by 100%. So the service is not there, the equipment is not there, people are not getting out of the hospital in a timely manner, they're going back to the hospital, they're falling, they're developing skin problems, they don't have wheelchairs, they're getting walkers, and it's not because we don't have the equipment, it's because we can't get the equipment. The doctors are asking for the equipment, we have an order for the equipment, Medicare has said you can have that equipment, but we don't have a provider for that equipment. So it's a real negative impact that we've had in this area for it.
And Cathy, explain to me your business.
We're a home health provider. What we do is if someone is coming out of the hospital, so they've been in the hospital and they're not quite well enough to come home independently, they still need nursing service, they still might need they might be recovering from a fall or from an exacerbation of a heart condition or a lung condition or from surgery. So they're too well to stay in the hospital, but they're really not sick enough to go into a skilled nursing facility, which would be using Medicare 30-day, which would be even more expensive from Medicare, really. So if they're safe enough to go home with our care, a doctor will write an order for a home health care order. Then he will usually assess the patient and say, well, you know, they really need a hospital bed because they have a tendency to get up in the middle of the night. So let's do a hospital bed with side rails or a mattress to keep their skin from breaking down. They can't quite walk from the front door back to their bed, so let's get them a walker or a wheelchair so they can do that safely. Let's get them a bedside commode so in the middle of the night they don't have to get up and walk to the toilet and fall. There's a bedside commode by the bed. And then let's put home health in with therapy. We'll have skilled nursing go out there and work with them, and we'll have a physical therapist and an occupational therapist work with them to get stronger, to where they can eventually do those things that they did independently before they went to the hospital, and then we can take the equipment out. We can cut back on the services until eventually there's no service. So it's a great bridge for people who come home a little debilitated and with intermittent therapy services and skilled nursing services, and usually the help of a caregiver in the home can stay in their home, get better in their home, and remain in their home. So it's really a very cost-effective measure, because a lot of times people will even go into a skilled nursing facility. Say they go into the hospital and they break a hip, and they'll go then into a skilled nursing facility for 90 days or 30 days. Medicare will pay for that full amount of time, and then they'll come home. But a lot of times with the right equipment and the right care, they can just go from the hospital right to home and forego that 30-day skilled nursing facility. And that's not in all cases, but it's in a lot of the cases. Now, without the equipment, it would be like, without us having the equipment, that would be like, you know, me telling you, drive to Houston. But, well, no, you don't. We're not going to give you a car, so walk. So you could get to Houston, but it's going to be a whole lot harder on you, and it's going to take a whole lot longer if you don't have the equipment that you need to get to Houston. You know what I'm saying? So the people could get there, but when we're not having equipment, we're finding falls, we're finding other injuries, because we're not getting the equipment in a timely manner. And that's not fair to these people. They've been through so much in the hospital, they're scared. Once they get home and they have the equipment and they have the skilled staff to help them, you just can't see the relief on their face, because everyone's so worried about even going to a skilled facility for 30 days. They think that means forever if they go. So it's a great the equipment is, it's not just some, I know there's been in the past, there's been a lot of rip-off of Medicare equipment, and of course that's caused a problem for upfront people and for people who really need it. And so it's almost like throwing the baby out with the bathwater. You know, oh, these people did it, so let's just crack down on everything. And that's really not fair to somebody that's 77 and has broken their hip and they want to go home and recover, and they can't get the equipment to do it. So they have to stay in the hospital for another 3 or 4 days, or they have to go to a skilled nursing facility. So I think the competitive bidding has really hit us hard in these small areas.